The next talk is by Alison Baird, which has been pre-recorded.
Good afternoon. Today I'm presenting our work on the development of an integrated mixed-scale fluidic cartridge with assays of accompanying extracellular vesicle messenger RNA markers and a potential application in stroke diagnosis. Expediting stroke diagnosis and treatment. This is because the mainstay of acute ischemic stroke treatment, intravenous recombinant tissue plasminogen activator, is only reaching around 5% of patients. And this is due to the short time window for treatment and the complex evaluation process. Many investigators have been working on this problem, including conducting community education campaigns to inform the public of stroke signs and the need to respond urgently. Also, mobile stroke units in some large cities can allow treatment to begin at the point of care. We've been investigating whether a blood test could expedite the evaluation process. We have previously shown the feasibility of this approach by identifying altered gene expression in circulating leukocytes as well as in leukocyte-derived extracellular vesicles circulating in plasma. In CD15 positive neutrophils and CD8 T-cell lymphocytes, we identified clusters of up to 3 to 10 upregulated genes that were highly diagnostically accurate. The genes were predominantly involved in immune and inflammatory responses and in vascular repair. More recently, we have shown that CD8 T cells stimulated in culture secreted extracellular vesicles containing the RNA cargo that reflected that of the parent leukocytes, although the messenger RNAs were truncated. In CD8 T cells, this panel of 5 transcripts was tested in a blinded plasma samples from Downstate and showed a diagnostic accuracy of 80%. Extracellular vesicles are attractive potential blood-based biomarkers because the RNA changes may precede that in the parent leukocytes and they may be more easily measurable. We are continuing this work in a 4-year proposal, the overall goal of which is to develop a novel technology platform for the point-of-care molecular diagnosis of stroke using extracellular vesicle biomarkers. I am working closely with my collaborator, Dr. Stephen Soper, an absolutely outstanding and distinguished chemical engineer at the University of Kansas. The clinical work of this proposal will be performed at Downstate in a 2-stage diagnostic validation study. Patients presenting to the ED will undergo a venous blood draw, plasma will be isolated, and then extracellular vesicles will be isolated from plasma using the liquid scan technology from Biofluidica, and this technology will be placed in the Baird laboratory. RNA expression will be measured using droplet digital PCR, and a limited RNA sequencing study will be performed in cell culture. The optimal RNA targets identified will be integrated into the cartridge developed in the Soper lab. Meanwhile, at KU, the microfluidic mixed-scale cartridge for the point-of-care technology will be developed. This will permit quantitative expression of up to 25 mRNAs in a 31-minute processing time. The 4 modules in the cartridge are, firstly, a module for extracellular vesicle selection, and these are cell-specific EVs. Secondly, a module for EV counting, and this is needed for quantitation of mRNA expression. After reverse transcription, which is performed on the motherboard, the purification of the cDNA will be performed in module 3, and then ligase detection reactions in Module 4. At the end of the 4-year period, the mRNA markers identified at SUNY will be integrated into the cartridge. Then, a proof of concept study will be conducted in 12 patients. Finally, I want to acknowledge all of my wonderful collaborators at SUNY Downstate and at KU. I'm hoping to conduct basic science correlative work with Frank to support this project. Also, Deborah has been a wonderful collaborator, and Yan Li, Ji Li and Hua Yu have been exemplary in the lab. At KU, I've worked with Dr. Soper for over 10 years on this project. Maggie and Hashani have been magnificent. Thank you.